Okay, I think we're all here. So straight up 1:15, we'll go ahead and get going. Welcome everybody to our bi-weekly update, but now weekly update for these couple of weeks on COVID-19 here in Bloomington, Monroe County, Indiana University, and Indiana University Health. We will start with some opening comments and then get to your questions. First of all, with Mayor John Hamilton.
Thanks very much. Good to be with everybody. Again, our quick update on local employment stats. We had 9 more positive employee cases this week with the 11 last week. That makes 20 in 2 weeks. That's a level of infection that we have not seen before. So that's very concerning. The CBU, City of Bloomington utilities numbers that I share were pretty steady at the pretty elevated rate, 160 at Blucher and 600 at Dillman in terms of RNA copies per 100 milliliters. Those are up substantially from what they were a few weeks and have been steady for about 2 or 3 weeks now. We continue to prepare for the Occupational Safety and Health Administration, OSHA rules, working to be sure we're ready for that going forward to assure that our employees either are vaccinated or are testing regularly to protect against the further spread of that disease at the workplace. I do just want to note of thanks to our community for being so steady and working so hard and caring so much. I know we're tired and this is difficult, but and I might get this wrong, but I think we're at the lowest county in terms of case rate per 100,000 out of 92. I don't know if I got everyone checking those numbers, but we're certainly among the very best counties just looking at that basic number of how many people are getting sick per 100,000. And that's, I think, a reflection of the good work of our community mask order that we have in place, unique among counties, and particularly thanks to institutions that are taking very strong action, paying close attention to this and doing the right thing, including Indiana University and Indiana University Health, the governmental entities. I just want to note that while we're facing real challenges, it's important to acknowledge how much people are doing in good ways to keep us as safe as we can. That being said, there is a lot of concern about the next several weeks. Of course, folks watching the news can see that as we watch Omicron and as we see the surge happening in Indiana in our area. We are literally canceling office parties. We did that just this week to try to reduce the risks of that. I know other events are getting postponed as need be, and let's just remember to put it in context. That can be a smart thing to do. We can come back and make up for that those events and do them later. I'll just close. I saw a quote that was shared with me from Ed Young of the Atlantic, really reminding us that we just have to work together on this, but not just work together, but in fact, to put each other's welfare front and center, to recognize that we've really got to have this leap of empathy to know we have to choose as individuals to embrace our common future, our common interests. Mr. Young wrote, quote, "Individualism could not beat Delta. It won't beat Omicron. Individualism won't beat the rest of the Greek alphabet to come. Self-interest is self-defeating, and as long as its hosts ignore that lesson, the virus will keep teaching it," close quote. Just doing this together, nurturing a spirit of togetherness, of giving and caring. It's exemplified so well by so many of our direct care workers in our community. And in this holiday time, it seems like a good reminder that it's not about each of us, but it's about all of us. It's about we, not me. And I'll hand that back to you, Chuck, and happy to take questions.
Okay, thanks very much. Let's next go to Monroe County Department of Health and Penny Caudill.
Good afternoon. Can you see my slide? Is my screen sharing? Was I successful? Excellent. So this week we do remain in an orange advisory. All 92 counties are in an orange or red advisory. We did have a slight decrease this week. We have 260 cases per 100,000, which is down from 279 last week. and we had a slight decrease in positivity as well. Now, when I look at those numbers today, I would say that we're going to be in that same ballpark, probably hovering between this week and last week, if our numbers hold true. Our fully vaccinated rate is 58.7% fully vaccinated, and 59.2% have received a first dose. So we are nearing the rate of fully vaccinated that we had prior to adding our 5 to 11-year-olds into our eligible populations. So we want to continue to see that rise, and we're glad that we're seeing people interested in getting those vaccinations. This past quarter, our public health clinic has given over 6,000 vaccinations, with over 2,500 of those being in children 5 to 11 years old. That is our public health clinic. That is not talking about other venues, providers, pharmacies, mobile clinics. I do want to thank IU for having their Moderna clinic, and I understand that that went very well, and I'm excited to hear about that. The Indiana Department of Health mobile clinic is scheduled for next week, and that's what my flyer is telling you about. It is going to be here Monday through Wednesday, noon to 8. It will be at Switchyard Park Pavilion, and big thank you to City Parks. We're so grateful. We had to do a quick pivot this week so that we didn't lose that unit coming to town, and we appreciate, I think that will be a superb location for this. So they will have all vaccines, they will have rapid antigen testing and PCR testing available. It is a good opportunity as we come up to the holidays to get your booster, to get a test if you need it, or to even start your initial series of vaccine before those holiday gatherings. So please consider keeping them very, very busy. The Indiana Department of Health Gravity site again is open. It is at that junction of Jonathan and Curry Pike at the old GE plant. That is Cook property. They are open Tuesday through Saturdays. Now, holiday hours, they are closed Christmas Eve and Christmas Day, New Year's Eve and New Year's Day. They are, as we speak, bringing in some trailers and extra equipment that will hopefully help them set up and reduce the amount of closures due to weather. So we have been working with them, specifically our public health coordinator is meeting with them to go over some guidelines and see what they're doing. But we're grateful that they are adding some measures to reduce those number of closures. We know that people need testing, and we want that site to be open. The Indianapolis Motor Speedway is still open through Wednesday as well. They are open today from noon to 8. They are open the 18th and 19th from 9 to 3 p.m. and December 20th to the 22nd from noon to 8. And they have all the vaccinations available as well as testing available at that site too. And I will just remind everybody that going to coronavirus.in.gov is your best source for testing options, and ourshot.in.gov is your best option for finding vaccinations. While Omicron has yet to be identified in Indiana, we do expect that it's probably here. It just simply hasn't been identified in a sample yet. And as I speak those words, they could be announcing that they've identified it. So that, that's how tenuous this is. But it is a reminder that this pandemic is not over. In November, the Indiana Department of Health did report that 81% of the COVID cases, 82% of COVID deaths, and 94% of COVID hospitalizations were in those who were unvaccinated. Breakthrough cases they do occur, but they are still a very small percentage of all the cases. A recent study from the Commonwealth Fund found that if there had been no COVID-19 vaccine available in the US starting last year, there would have been an additional 1.1 million deaths and over 10 million hospitalizations in the US. As holidays continue to be celebrated and we we make our plans to gather with family, I ask that you take a moment to pause, assess the risks around you, and do what you can to reduce the risk of illness, not only to yourself, but also to those that you care about and gather with. And I wish you a safe and a healthy holiday. Thanks, Chuck.
Okay, let's check in with the Monroe County Commissioners and Julie Thomas.
Good afternoon, everyone. Thank you all for being here, and appreciate everyone's attendance and attention. This is a really important time in our community and across the state and the nation. I just want to first and foremost thank all of those who put the community first in everything that they do. And it starts with our healthcare workers who have just done a heroic feat in keeping us safe. And we cannot thank them enough, but the best way to thank them is to get vaccinated and to wear your mask when you're out outside in public, in a public space. That's going to be what's really important here. And it's just a good reminder. We really appreciate having another vaccine clinic, which is excellent and excellent news. And we do encourage those who have not yet been vaccinated to please utilize that service that's available for you. And residents who want updated information on things like mobile vaccine clinics should go ahead to co.monroe.in.us, our website, and at the middle of the page, you'll see a megaphone. Click on that and sign up for the resident alert system. We do put this information out on the resident alert system every time something occurs. Also a note, we continue to offer, Monroe County is proud to continue to offer the Township Assistance Fund. This is funding that goes through our township trustees who manage it and administer it. This is funding directly for residents who need assistance with to pay for basic necessities. And as of this week, the funding has reached $200,000. So if you do need help, please find your township trustee, contact them. You can call 211, or you can contact in211.org to find their contact information. For everyone who's doing the right thing, thank you so much. We are in this together, and we appreciate everyone's hard work, and please stay safe out there, and we'll take questions. Thank you.
Okay, let's next go to IU Health and Brian Shockney.
Hello all, and thank you for being here today. As others have shared, the past couple of weeks have been pretty busy, not just here in our region, but at all of our hospitals across the state. We continue to keep a very close eye on our COVID numbers and are cautiously optimistic about a slight leveling off of COVID patients we're seeing in our hospitals. Past trends indicate that in the next few weeks will be the most important time for us to get out of this very difficult time we're in as hospitals and healthcare providers. We are seeing the same trend in the numbers between IU Health and Bloomington and Monroe Hospital representing this region. This week, the IU Health system as a whole experienced the highest COVID-19 inpatient census since the pandemic began, while we also celebrated the first one-year milestone of the first vaccines given in the state of Indiana. We didn't think 1 year after the vaccine became available, we would see our highest COVID-19 volumes to date. That just seems unreal that we have a vaccine and we're in this state of highest numbers of inpatients in our hospitals. Statewide, positive cases by day are starting to level off, which tends to be followed by a similar trend in the following weeks in our hospital inpatient numbers. While we're cautiously optimistic, the holidays with its related parties and family get-togethers are here. It's imperative that we all take precautions during this time. Our January and February can be a good January and February and not the same as December if we do the right thing. As of Wednesday, the state reported 17,562 deaths due to COVID. People continue to die from this virus here in our hospitals and here in Monroe County, and we can't take this lightly. Since the beginning of the pandemic, many individuals have compared COVID-19 to the flu virus, and according to the CDC, Indiana lost 933 individuals to the flu. These numbers are not even remotely comparable to the 17,000+ who have died of COVID here in our state. If you look at this graphic, you'll see that unvaccinated people still make the majority of individuals who need hospitalization when they have COVID-19. That means they are so ill that they need medical help to maintain their ability to function daily and in many cases to breathe. The impact of this virus can be greatly minimized if you are vaccinated. So please be vigilant. Wear a mask when around people that you don't live with, when you're out in public, social distance, wash your hands, all those things we've been saying for 2 years. These steps are necessary to ensure we have a 2022 that provides greater freedom for us all. It ensures healthcare providers can get back to caring for patients who need important surgeries, and it'll protect our loved ones. I also want to say thank you to all our healthcare heroes and our first responders. They've been at this for 24 months. They still have that dedication and that passion to saving lives. So as we come to the end of the year, this 2021, may we enter this new year with a chance to reflect on the past 2 years of this pandemic and look to do something different, maybe even daring, that will contribute to stopping the spread of this virus. Maybe you could do something different than you did in 2020 and 2021 that would reverse the effects of this virus on all of us. We would be happy to talk with you about that. Be well.
Okay, and we'll next check in with Indiana University. We'll start with Aaron Carroll and go to Kirk White.
I don't want to take up too much time repeating things that have already been said, but clearly everybody's concerned with both increases in cases across the state, as well as the fact that Omicron is likely already here, if not will be here soon. IU finished off the semester, or we're finishing off as we speak, reasonably stable. The number of cases the last 2 weeks have been quite stable and are lower than the week before, which is great. Of course, everybody is headed home for the most part in the next day or so, and today being the last day of finals. And so I expect the next few weeks to be reasonably quiet for us. Next semester, however, will be influenced heavily by whatever Omicron seems like it's likely to bring. If you're looking at places across the country, it is clear that it is very rapidly spreading, and that it's something we absolutely need to be watching and concerned about. I expect that more data will be coming in over the next few weeks, and we'll be continuing to watch that. But at the moment, we're holding tight. We're going to be encouraging boosters strongly as we can, trying to get everybody boosted as soon as we can. We did 3 days of open pod clinic in Bloomington this week, as you've heard about. We did between 2,500 and 3,000 vaccinations. I'm sure we will continue that and double and triple down in January to try to get as many people vaccinated as possible. But overall, for the semester, with an ongoing pandemic, I think we're satisfied with how things have gone, and we will continue to try to keep up that high level of safety as we move into 2022.
Well, thanks, Dr. Carroll. And as Dr. Carroll mentioned, our numbers at the Bloomington campus are relatively steady, but did tick up a little bit from last week. We had 118 cases on the campus this past week. But as Dr. Carroll said, we're steadying up a bit. 99 of those 118 were students. And speaking of students, today is the last day of finals, and the Bloomington winter commencement will be tomorrow. So the campus will get pretty quiet here over the next few weeks. And we are very thankful for our team at the Student Health Center and our events staff and our folks at athletics who allowed us to get that clinic done this week, Monday through Wednesday at Simon Scott Assembly Hall, where latest count is 2,429 vaccinations, the big majority of those being boosters. So that's great that people were able to take advantage of that. Looking forward at Bloomington, we expect to be able to host the Indiana Department of Health's strike team in cooperation with Monroe County Health Department on the 5th through the 8th of January. So that first week of the new year. And we hope to do that at our facility at 11th and Indiana Avenue, and more to come on that. But that would be a full state team with vaccines and tests, January 5th through the 8th. But we'll get some more information as that gets finalized. And then, as everybody probably knows, spring semester starts on January the 10th. So we'll be ready for that. And as Dr. Carroll mentioned, we're watching the Omicron studies out of Cornell and other places closely to make sure that the campus will be prepared for whatever contingencies may occur as the new year begins. Thanks, Chuck.
Okay, we're happy to take your questions, but we will have to have some. So there are none that have come in at the moment, but I know that you have them. So for our media here, go ahead and put your questions in the chat, if you will. Dr. Carroll, I'm going to go back to you in the meantime, though. The question, of course, that's coming up a lot right now is, are you concerned about a surge when students come back to our campuses, Bloomington here specifically, after having gone home for the holiday?
Yes, of course. I mean, we're concerned about surges all over the place. Watching what's happened at other schools, certainly it is absolutely a concern, but I fear that there are going to be surges regardless. Just looking at what's happening in many countries and in many states, this is a very, very transmissible virus, or variant, I should say. So yes, and the best thing that we can do is vaccinate, which we've mostly done already, and booster, of course. And so we're just going to continue to work towards that.
Question from Patrick McGurr at the HT for Penny, asking, you may have already spoken about this, but will the gravity testing site have altered hours because of the holidays?
Yes, they will be closed on Christmas Eve and Christmas Day, New Year's Eve and New Year's Day.
Okay, waiting for another question to come in. I'm going to go back to Brian. Can you elaborate a bit on these numbers out of IU Health statewide with the highest numbers of, well, define it for me. Is it the highest number of cases that we've ever had in the COVID pandemic at this point?
Highest number of census inpatients. So every day, every hour we're turning patients, people being admitted and patients being discharged for COVID. And we hit that highest number of inpatients. And, what we're seeing with this Delta variant is it's just so strong that it's requiring hospitalization of mostly, as we've talked about, the unvaccinated. And the lengths of stay for these patients is long as well. And so, when you look back over as I said, you look back over the 24 months and 23 months, whatever it's been, and you think, okay, we started giving our first vaccinations a year ago. How could that be? How could, when we give flu shots and other vaccines in our history of our nation, and it's because I think the mayor's comments, I just appreciate his comments around this we can't be individuals. We've got to work together, and we've got to work as communities together to do what's right, to protect each other. No matter what that is, it may not be vaccination for you. It may be just wearing a mask and protecting others. But what can we do to protect our community? We're almost exactly 2 years out, a year from a vaccine, and yet we're seeing some of the highest numbers we've seen since this pandemic began. And I think about that, and I think about the science of that. It's concerning.
Now, Brock Turner from Indiana Public Media follows up and asks about, to you, Brian, how can you be optimistic about the state of hospitalizations as IU Health logged its highest census numbers this week? There are only 6 ICU beds available through the district, throughout District 8. What leads you to be optimistic?
Well, my team tells me I'm always half full guy. So I told my team this morning on Incident Command, I said, we need hope. So what can you tell? I told my chief medical officer, what can you tell us that's hopeful? We're leveling off, that 2 weeks from now, it's going to be better. We've been at this a long time, and healthcare workers are very, very tired. And we're using spaces in our facilities in this South Central region and in this district that we've never used before to care for patients because the need is there. And so, but I have to keep hopeful. That's what keeps us going. And we know that we've had other surges, and they also have declined, right? Eventually they decline. And so we just hope that we see the numbers start to decline so that we can get into the holiday season, get into 2022, and get people back to getting their surgeries that they need. There's no one on the list right now, our surgery list, which is long, that doesn't need that surgery. But we can't do it right now because we're carrying, all of our resources are toward caring for these COVID-19 inpatients. So boy, you got to have hope in these times, right? And this is a season of hope.
Question from Holden Absher from Indiana Public Media for Aaron Carroll. What is the smartest thing for people to do this holiday season? Should people celebrate with family, and what about travel?
Well, partially it depends, but if everybody is vaccinated and hopefully boosted, then yes, that's probably pretty safe. It also depends what you're doing when you travel, not so much travel itself. If you're driving somewhere to spend time with a small number of family, all of whom have been relatively careful, that's very safe. If you're, getting on a plane and flying to go hang out at a massive indoor concert, probably not very safe. So the travel is important, but not nearly as important as what you do once you arrive. But if you wanted to have added safety, certainly you can make use of antigen tests right before you get together, when you do get together. We'll probably see my in-laws in the next 2 weeks, and I can imagine we might all test right before we do that, just to make sure we don't put them at risk, even though everybody is vaccinated and have boosted if possible. But again, the biggest, best thing we can all do is be as vaccinated as possible. And if people are doing that, then they are so much safer than they were last year, that it is totally within the realm of safety to go and be together.
Question from Rock Turner for Brian. Have all elective procedures been canceled at IU Health's South Central region?
Thank you for asking that. Yeah, they have been. We triage every day. We have a team that triages every surgery every day. We look at the emergent cases and we do those first, and then we see the ones that are very urgent, and then we do those. But any cases that are elective, that truly aren't, that fitting that urgent or emergent criteria, have been postponed until we can get out of this pandemic. So, we keep telling our patients, we hear you. For example, there's people who need hip and knee replacements. They're in pain every single day. Some of them, struggling to walk because of hip and knee pain. But, if it's high need, and they've got high acuity and they really need to get that done, we're going to try to get them in at some point, but otherwise we have to wait. And boy, it would sure be nice to be able to do what we all got in healthcare to do, and that's to relieve pain, and do that in balance with caring for the sick as well.
Okay. We have no other questions at the moment. I'll give it a moment before we sign off here. In that time, I will tell you that tentatively, we're thinking about December 30th for coming back for a news conference. That is a Thursday, time TBA, roughly around this time, I will say at this moment, but maybe slightly earlier, but that is still to be determined. And so we will let you know, of course, in the usual way. We'll send out the release well before, so that we can let you know when we are having this media gathering again. But in the meantime, still not seeing any other questions. So I'm going to give it just a second more before we sign off for the holidays until December 30th. And seeing none, we will call it a day there, and we'll see you then again on December 30th.
Be well,
Happy
everyone.
holidays, everyone.
Happy holiday.
Stay well.